Welcome everyone. Today we will discuss about the disease called PCOS, polycystic ovary syndrome. This is a female disease. This is a problem with hormones that happens during the reproductive years. If you have PCOS, you may not have periods very often, or you may have periods that last many days. With PCOS, many small sacs of fluid develop along the outer edge of the ovary. These are called cysts. The small fluid-filled cysts contain immature eggs. These are called follicles. The follicles fail to regularly release eggs. The exact cause of PCOS is unknown. What are the symptoms of PCOS? The symptoms of PCOS vary in each person with respect to their immunity, genetics, environment and living style. The main and most common occurring symptom is irregular periods, missing periods, or you can say light periods in intervals, acne, stinging menstrual pains, large ovaries with ovarian cyst, infertility, irregular ovulation or no ovulation, difficulty getting pregnant, pain discomfort during sex, high androgen, lower back pain, pelvic pain and pressure, insulin resistance, excessive hair growth of face, chest, back or buttocks called hirsutism, dark or thick skin patches on the back of neck, armpits, or under breasts, loss of hair on head called male pattern hair loss, enlarged abdomen, low sex drive, inability to lose weight, etc. Now we will discuss that what are the causes of PCOS. In causes, the number one is genetics, and then low-grade inflammation. And in complications we can add insulin resistance and excess androgen. In hereditary, certain genes might be linked to PCOS. Having a family history of PCOS may play a role in developing polycystic ovary syndrome. In low-grade inflammation, white blood cells make substances in response to infection or injury. This response is called low-grade inflammation. Research shows that people with PCOS have a type of long-term low-grade inflammation that leads polycystic ovaries to produce androgens. This can lead to heart and blood vessel problems. In insulin resistance, too much insulin might cause your body to make too much of the male hormone, androgen. You could have trouble with ovulation, where eggs are released from the ovary. One sign of insulin resistance is dark velvety patches of skin on the lower part of the neck, armpits, groin, or under the breasts. A bigger appetite and weight gain may be the other sign. In excess androgen with PCOS, the ovaries may produce high level of androgen. Having too much androgen interferes with ovulation. It means eggs don't develop on a regular basis and aren't released from the follicles where they develop. Excess androgen also can result in hirsutism and acne. Now we will discuss about the diagnosis of PCOS. What are the diagnosis of polycystic ovary syndrome? Firstly, the doctor will note down your present complaints with medical history. Check any physical change and note down. Also note down another related condition with family history that causing any type of discomfort. You can advise blood tests. Blood tests can measure hormone levels. This testing can exclude possible causes of menstrual problems or androgen excess that mimic PCOS. You might have other testing, such as fasting cholesterol, etc. Thirdly, we can use a radiology procedure of ultrasound. The ultrasound can check the ovary's appearance and the thickness of the lining of the uterus. The transducer emits sound waves that are translated into images on a computer screen. In pelvic exam, your provider can check your pelvic organs for masses, growth, or other changes. These were the commonly used procedures for PCOS. Now we will discuss what is the treatment of polycystic ovary syndrome. In the treatment of this syndrome, we have healthy and best methods to control polycystic ovary syndrome and optimize your imbalanced body back to normal healthy life without lifetime medications. You should treat your polycystic ovary syndrome early. It is quite easy to hold on it before malignancy. We use different methods, medications, lifestyle changes, counseling, exercise, Now don't panic for polycystic ovary syndrome and get proper treatment with 24-hour quick care support. Book your appointment during consultation hours for treatment without surgery. This will be a best and magical treatment for your health without any side effect. Thanks for watching. Don't forget to subscribe, like, and share the video with other suffering people. Take care.